everyone. Welcome to the University of Queensland's Study Medicine at UQ webinar. So I will just wait for a minute to let the attendees settle in first, as I can still see people signing in, and we will start very shortly. Hello again. My name is Irene Hui. I'm the International Manager at the Faculty of Medicine, and I'm also your host for today. Lovely to see many of you signing in, tuning in for tonight. So before we start, I would like to go through a few housekeeping things. So I would like to let you know that we are recording this webinar and we will be sharing the recording with you later in the week. And during our presentation, if you have any questions, feel free to use the chat function on Zoom to ask your questions. We have colleagues here to answer your questions if it is a quick one. Otherwise, we will also address them in the Q&A session later on. And now I have the great pleasure to introduce you to our three speakers for today. The first speaker will be Professor Stuart Carney, Dean, the UQ Medical School, who will be sharing his insights into the current and future healthcare challenges. Professor Carney will also give an overview of the UQ Doctor of Medicine program. We will then have Ms. Kelly Cox, Admissions Coordinator at the Faculty of Medicine, to walk you through the admissions and requirements and the application timeline. After that, we will have our current MD Year 1 student, Patrick Tan, sharing his experience as an international student in Brisbane. We will then have a Q&A session at the end to give you an opportunity to ask us some questions. And of course, as I said before, you can use the chat during the presentation and we will address them in the end. And now let me pass it on to our first speaker for today, our Dean, Professor Stuart Carney. Over to you, Professor Carney, please.
Thank you very much. So I'm just about to share my slides. Thank you. Bear with me a moment. I will... That's it. Okay, PowerPoint. Apologies, I'm having trouble with my computer. I'll have to unshare the slides and then try again.
Yeah, no problem.
You bear with me a second. You'd have thought after the COVID pandemic that this would be second nature, but unfortunately, my computer seems to have a mind of its own. There we go. Are the slides now appropriately shared? Second time lucky. Thank you very much. Thank you, Irene, for the introduction, and hello to everybody who is joining us today. I'm Stuart Carney, Dean of the Medical School at the University of Queensland, and it's a great joy to be with you tonight with colleagues to share some insights into the issues we're grappling with within healthcare and how our medical program has adapted to equip the next generation of clinician leaders to address those challenges here at the University of Queensland. As is our custom, I'd like to start by acknowledging the traditional owners of the lands upon which we meet. For those of us here in Brisbane or Meanjin, we're on the unceded lands of the Agaro and Turrbal peoples, and I'd like to pay respects to elders past, present, and emerging as we walk together on the path to reconciliation. So I'd like to start with a picture of the main medical school building, and Patrick probably hasn't spent much time at this building, but it's where the administration for the medical school sit, and it's a sort of beautiful building on our Hurston campus near the Royal Brisbane and Women's Hospital. I highlight this particular sort of picture to sort of is to say that we recognize you have choices, and we're enormously grateful that you are joining us today to consider applying to the University of Queensland. But I'm going to start where I will finish, and that is you do have choices. There are lots of ways in which you can make a difference, and there are lots of great medical schools around the world. And included in them, I would argue the University of Queensland Medical School is one. And on the subject of the University of Queensland Medical School, we rather courageously, back in the 1930s, sought to put above the entrance to our medical school the title The Medical School, suggesting that perhaps we were the only one that was the medical school. But joking aside, I think there is a lot to commend what we do at the University of Queensland. For those of you who aren't familiar with Australia and the work of the University of Queensland, Australia is a large country. It is the same size as the contiguous United States, has a much smaller population than the United States. So we have a population of around 25 million people. The majority of people in Australia live around the coasts, but we recognize our responsibilities to ensure that everybody, irrespective of whether they live in an urban centre or in regional, rural and remote communities, have access to excellent healthcare. And as the University of Queensland, we are sited in one of the 6 states that make up Australia, a state which is around 9 times the size of my original homeland, the United Kingdom, and 6 times the size of Japan, and Brisbane sits in the bottom right-hand corner of that state. As a university, we are a global university, a university ranked typically in the top 50 of international league tables, and that's largely on the back of our excellent education and research, but also the international partnerships which we foster. And amongst those international partnerships is a partnership with the Ochsner Health System in New Orleans. And if you were to join us at the University of Queensland, 90 of your classmates who will be studying side by side with in years 1 and 2 will be US citizens, US permanent residents who will spend their 3rd and 4th year back in the United States. It does provide wonderful opportunities for clinical placements for those who are interested in exploring the US as well. But the majority of our students are based in the southeast corner of Queensland, in and around Brisbane. But we also, as I say, have responsibilities for improving access to healthcare in regional, rural and remote Queensland through our Rural Clinical School, which is based in Toowoomba, Bundaberg, Rockhampton, territories up to at least a 1,000 kilometres away from Brisbane, and a sort of wonderful experience of the provision of healthcare in a generalist setting. So let me talk about some of the major challenges, some of the drivers, some of the things that keep us awake at night as we sort of work out how can we equip you, the next generation of clinician leaders, to really grapple with and address the major healthcare challenges that we're facing around the world. And if I was to give this presentation around 5 years ago, before the COVID pandemic caused significant challenge for our daily lives, I probably wouldn't have started off with communicable diseases. I think we all recognize the enormous challenges that the world is facing, particularly around the provision of healthcare as it relates to our aging population, and traveling with that aging population is comorbidity. But what COVID reminded us, something perhaps we'd become a little complacent about, is that infectious diseases are also a major challenge for our healthcare system. And COVID, of course, didn't discriminate, but the experiences of COVID were most acutely felt by our aging population and those who are living with comorbidity. So I think applying that more broadly, as a university, we recognize our responsibilities similarly to develop innovative strategies to deal with communicable diseases, with infection. And the University of Queensland is proud to count amongst its key staff people like Ian Fraser, the developer of the Gardasil vaccine around HPV, and we're at the forefront of the development of RNA vaccines now for a range of conditions. But I think other conditions that you, as the future healthcare leaders, will be grappling with is what happens as we become more, as bacteria become more resistant to the antibiotics that we use. Unless we develop new antibiotics, in 20, 30, 40 years' time, things like a hip replacement or a knee replacement may become more and more challenging. So we're looking to you to push back the boundaries of knowledge. But as I say, one of the other major challenges that we face around the world is our aging population. And whilst Australia is a reasonably young country, we're not immune from that. And with aging comes the increased risk of chronic conditions. And amongst those conditions that we grapple with are conditions such as dementia. 469,000 Australians currently living with dementia. So the healthcare system that you will be part of will have to ensure that it can provide for the needs of that aging population, a population who are living with chronic conditions such as ischemic heart disease, diabetes, depression, dementia that I've mentioned. I think what the world's healthcare systems are increasingly grappling with, and we've become very good, particularly in a world which has become much more specialized and super specialized, is the care of individual conditions. But with age and with our sedentary lifestyles come the risk of comorbidity, living with 2 or more chronic conditions. And what we do know is that if you have a single condition, our specialists are often well placed to provide optimal care. But for those of us living with 2 or more chronic conditions, a more generalist approach is particularly beneficial. And I think the pendulum is, and quite rightly, has to swing back to a more generalist approach to healthcare, be that they're general practitioners, our rural generalists, general pediatricians. And even in my area of psychiatry, I think we recognize our responsibility, the need for psychiatrists to be better equipped and the system as a whole to be better set up to care for individuals' physical needs and not just their mental health needs. So the world that you're sort of embarking on, the world that you're considering, the world where I hope many of you will become our future healthcare leaders, will have to deal with the challenges of communicable diseases, an aging population, and comorbidity. So it's against that backdrop that I have I think the sort of the best job in the world. I get to sort of to work with some of the brightest students, brightest staff, dedicated professional staff, dedicated academics and clinicians who are all committed to pushing back the boundaries of knowledge. People like Michael Wagels, pictured here, a surgeon, an orthopedic surgeon who has pioneered the use of 3D printing, for example, in the development of replacement limbs for individuals who have lost bones as a consequence of road traffic accidents. The first individual to undertake a tibial transplant here in southeast Queensland. But for all that talk of technology and 3D printing, telehealth, electronic patient records, ChatGPT, artificial intelligence, yes, they're great augmenters, they're great assistants, supporters for us as healthcare professionals. I don't think the future of healthcare can do without people. At its heart, medicine is and will continue to be about people. It will be about some of those qualities such as empathy, compassion, kindness that we bring as healthcare professionals. The sitting down with an individual in distress, the use of all of our senses to pull together a comprehensive picture about what is troubling the individual we're caring for, and enabling them to make an informed decision around what is the most appropriate course of action to address the conditions they're currently living with. So those human qualities are and will continue to be critical in the provision of healthcare. So, having said all of that, what does that mean for you as a future MD student? So recognizing that the world that you will be practicing medicine is evolving and will continue to evolve. When I was at medical school, I know it's hard to believe it was a good 30 years ago, knowledge doubled every 5 years. Today, knowledge doubles every 72 days. So how do we equip you with the skills to be a scholar, a scientist, curious, continually asking those questions and being able to draw upon all of that information? A critical thinker, but as I say, for the next 40, 50 years of your professional careers, you will have to be a dynamic learner and continuing to draw upon the best available evidence as it continues to evolve and develop to provide optimal care for your patients. And medicine is only the first stage in that long journey, which will include postgraduate training and then continued professional development throughout your professional career. So setting you up for success in the context of a 4-year MD, is around helping you to integrate those capabilities, those skills, to recognize that the care of patients is more than individual body systems. It is around that holistic approach, and that for us as clinicians, transitions are often challenging. We have a particular focus on helping you sort of move from the classroom-based environment into the clinical environment, be that the community or be that the ward, and then ultimately into your internship and the early stages of your postgraduate career. So the program is very much structured around bringing the biomedical science and the population sciences to life with increasing meaningful clinical experience. Year one typically spent in a classroom type environment, most typically at our St. Lucia sort of main university campus, with a team-based learning structure, moving into year two, which is around almost a 50-50 split between clinical experience and classroom-based experience. And then incrementally into year three, 80% rotating through the disciplines that you'll be familiar with: child health, women's health, medicine, surgery, mental health. And then year four, seeking to recognize the added complexity, working in complex systems, working as a member of a multidisciplinary team, and seeking to apply that knowledge to the care of individuals with both acute and chronic conditions. Opportunities for choice through the elective, and then a real purposeful focus on that transition to practice in the last few months of year four, as you prepare for the next stage in that journey, the move into internship or residency. As a research-intensive university and a comprehensive university, world-renowned for the quality of our research, there are lots of opportunities for you to develop your research capabilities. All of us as doctors need to be curious. So everybody, by the time they graduate, should be curious and able to sort of to address and ask answerable questions, use that research literature to inform clinical practice. But some of you may want to be future clinician research leaders, and there are opportunities for you to undertake an MD, PhD, or an MD, MPhil, as well as other extracurricular opportunities. We also recognize that studying medicine can be tough, and the need for support, for connectedness, not only with your peers through the UQ Medical Student Society, but also through student services, confidential quarantine support, totally separate from any academic decision-making or progression decision-making. And for those students who wish, a personal advisor network from the from the second half of year one, an opportunity to have a faculty advisor who will walk with you for the remaining 3.5 years of the program. And also, as Patrick will be able to sort of unpack for you as well, there's more to coming to medical school than just what happens in the classroom. And I think our greatest gift are your classmates. And I'll let Patrick speak a bit more about that. So what happens to our graduates? Yes, we have the pleasure of working with you for 4 years, but then there's another 40 to 50 years beyond that. Many of our graduates, including in particular international graduates, often think that around what are the employment opportunities when you come in. And Australia, as a nation, is a nation that very much cherishes and values the contributions of the medical profession. Whilst many of our students look to go home, by the time they complete their program, many of our graduates decide to stay in Australia. And whilst everybody gets a job, almost 90% of our international students choose to stay in Australia, be that for love of Australia or be that for love of somebody in Australia. But as I said, sort of you've got plenty of choices and options, but there's no shortage of work for you here in the Australian context. And amongst the sort of the places where our graduates ultimately sort of work when they graduate, working in the hospitals here in Queensland and across Australia more generally, Singapore, we have a proven track record of supporting graduates undertake their housemanship in Singapore. Similarly, Canada, the United States, and elsewhere around the world. So let me finish where I started. And that is, there are lots of ways in which you can make a difference. You can make a difference as a lawyer, you can make a difference as a public servant, make a difference as a nurse, physiotherapist. You can also make a difference as a doctor. As a university, we are committed to working with individuals who are truly committed to pushing back the boundaries of knowledge. And if what I've said has resonated with you, then we do hope you will consider joining us here at the University of Queensland. But don't take my word for it. Patrick's here as well. He can give you a first-hand experience of what it's like being a student. Before I hand over to Patrick, I'll hand back to Irene, who will introduce Kelly, who can speak about the admissions process.
Thank you very much, Professor Carney, for your sharing and insights. And for those who do want to choose UQ as your medical school, I have the pleasure to have Kelly here. So Kelly Cox, admissions coordinator for at the Faculty of Medicine, to talk about the entry requirements and the application timeline. But before I do that, I know some of you joined actually quite recently, so after my housekeeping. So I just want to say we are recording this webinar and we will be sharing the recording. And also, if you do have questions, feel free to use the chat function on Zoom to ask the questions. We have colleagues to monitor the chat and give you quick answer. Otherwise, we can also address that in the Q&A session. Thank you. So Kelly, over to you.
Thanks, Irene, and welcome everyone. It's great to have you here. I will do the same as Professor Carney and just share my screen. Okay, so hopefully you're all seeing a wonderful PowerPoint slide there. Okay, so I'm here to talk to you about the application process. So UQ has two entry points to our Doctor of Medicine. There's the provisional entry point and the graduate entry point. There are a few little differences between the two, but primarily the big difference is that our provisional entry pathway is for current school leavers. So they are people who are currently in year 12 or in their final year of senior secondary school, as opposed to our graduate entries who have already completed a key degree or are in your final year of your key degree. So obviously the provisional entry students are going to take a little bit longer because they need to complete their undergraduate degree first, but that can be done at UQ with a guaranteed entry into the Doctor of Medicine upon completion of the final requirements, which we will talk about in a little bit. So we have approximately 45 places for international provisional entry and 100 places for graduate entry. Also, something to note that's on your screen right now are the application deadlines. So we have 2 rounds for graduate entry applicants. First round, the due date for application is the 14th of June, and the second round is the 8th of August. For our provisional entry students or applicants, if there is anyone here, you have until the 27th of September. Okay, obviously there are requirements that you must meet. So we're going to start off with graduate entry. Graduate entry applicants need to have an admissions test completed. So that can be either the GAMSAT or the MCAT. GAMSAT, you will need at least a minimum of a score of 50 in each section. And for the MCAT, you need a minimum score of 504. GPA for your key degree needs to be 5 on the UQ 7-point scale. And there are, of course, subject prerequisites. So our prerequisites are in integrative cell and tissue biology and systems physiology. We have a website that you can go onto and have a look at a variety of courses and programs from universities all around the world, as well as here in Australia, and to see whether you have actually studied anything that will meet those prerequisites. If you haven't, that's okay. It doesn't mean that you can't apply. Absolutely apply if you really want to come here. It would be wonderful to see your application. We do have the opportunity, if you don't meet prerequisites that have already been assessed, we can have a look at what you have studied and see if you meet it with something else. Or we do have a free course that you might be able to complete that will also meet the prerequisites. So it's just an online course. It doesn't take very long to do, and you'll meet the requirements. Okay. Then there's also the English requirement. So you can meet that through a variety of exams, such as the IELTS or TOEFL, but there's also other ways that you can meet these requirements, such as prior study in the English language, either at high school or in your undergraduate degree. As Professor Carney said, being a doctor is about more than just study, it's about people. So one of the other requirements that we have is the multiple mini interview. The multiple mini interview is about assessing non-academic qualities such as kindness and compassion, integrity, adaptability, as well as your verbal communication. To be invited to interview for that multiple mini interview, we create a total score based on 50% of your GAMSAT or MCAT score and 50% of your GPA. After the interviews, we actually make offers based on 25% of your GAMSAT or MCAT score, 25% of your GPA, and 50% of your MMI score. Okay, so the fees for the Doctor of Medicine, for 2025, it's $96,400. No scholarships are available. There are some additional costs, such as making sure that you have your CPR certificate, your first aid certificate, and your CPR training. And students are expected to fund any travel and living expenses that they require. Okay, again, the important dates, very important information, the application timeframe. So for provisional entry, application, as I said before, it is due by the 27th of September. You can apply either directly through UQ or through QTAC, the Queensland Tertiary Admissions Centre. The MMI dates, so the interview dates will be in November and the offers will be released in mid-December. If you're interested in our graduate entry point, then we have, as I said before, 2 rounds. One where applications close on the 14th of June, and round 2, the applications close on the 8th of August. For these applications, you apply directly to UQ. MMI rounds, the interview rounds are in July and September, and offers will be made in August and October. Okay, so for provisional entry, very similar requirements. There needs to be, instead of a GPA, there is the ATAR or an ATAR equivalent of 95. There is the English prerequisite, and you also need to complete an admissions test exam. So instead of the GAMSAT or the MCAT for provisional entry applicants, it is the UCAT ANZ. So again, provisional entry applicants need to meet an English requirement, and that can be done in a variety of ways, such as the test scores or completing high school in an English medium instruction English. Now, you would also need to, because applicants to the provisional entry medicine also choose which undergraduate degree that you would like to do, you would also need to meet the minimum English language requirements for the undergraduate degree that you would elect to do before moving into the Doctor of Medicine. And please note that some of those are actually sit higher than the provisional entry medicine requirement. Again, provisional entry applicants need to sit an MMI. These are really very much about non-academic qualities. So there'll be a situation where you just need to respond to that situation. We're not going to be testing you on the Latin terminology for different anatomical parts of the body. So you don't need to worry about that for the interviews. It's really very much about situational awareness and how you would manage in these different situations. Okay, so fees. The bachelor's degree, the undergraduate degree, there'll be varying varying costs for that because you get to choose which undergraduate degree you would like to study. For reference though, a lot of our students do elect to choose to study the Bachelor of Biomedical Sciences, and for 2025 it is $53,760 per year. So provisional entry progressing into the MD. So it's very important to understand that although a provisional entry place does give you a guaranteed spot in the Doctor of Medicine program, it is only if these requirements are actually met at the end of your undergraduate degree. So you must complete your bachelor degree within the minimum time frame required. So if it would normally take three years to complete, you need to complete it in 3 years. You do need to achieve that minimum GPA of 5 on UQ's 7-point scale, and you do need to meet the 2 prerequisite requirements. What if you don't meet provisional entry requirements? Doesn't mean that you don't get to go into the Doctor of Medicine. It just means that you might have to take the graduate entry pathway. So you might consider actually applying for one of our other undergraduate degrees, such as a Bachelor of Biomedical Science or a Bachelor of Nursing, and use that as your key degree and apply through the graduate entry pathway. Okay, I'm just going to stop sharing and I'm going to pass it back to Irene. Thanks, Irene.
Thank you, Kelly. Thank you for the information. I already see some questions in the chat. As I say, we answer some of them live. We'll answer some of them live during the Q&A session later on. So we are now moving on to Patrick. So Patrick is our current Year 1 MD student, and he's originally from Singapore, and he's enjoying life here as an MD student at UQ and in Brisbane. So I will let you to introduce yourself, Patrick. I know you have an amazing presentation, mainly the photos, to share with us. So over to you, Patrick.
Hi, yeah. You guys could all hear me well, and my slides are sharing well. All right, fantastic. So, hi, good evening, everyone. So, before I begin, I just want to extend my gratitude towards the professor, the dean, as well as the Faculty of Medicine for inviting me today to talk to you guys. So, hi, my name is Patrick. I'm originally from Singapore, and I'm currently a first-year medical student here in UQ. So, for class of 2027, which means that I just started this year. And before this, I was actually doing 3 years of my undergraduate as a biomedical student. So hopefully today, I'll be able to give you guys some form of insight into a student here in UQ and share with you what it's like to be a student here, to live in Australia, and to go through a university degree in the University of Queensland. So getting into medicine is a journey I will never forget myself. Many sleepless nights as well as anxiety-filled days trying to get through my undergraduate degree as well as going through GAMSAT and MMIs. But that is not all there is to it as a student here. There's a lot more to it than just education. So trust me when I say this, that work-life balance is one of the biggest factors that push me towards studying here in Australia, especially coming from a country where work-life balance isn't as highly rated as some of you would know. So trust me when I say this, that as medical students, we study hard, but we play even harder. So you can see from all the pictures that I've shared with you guys that whenever there's a new opportunity presented to me outside of education, I will grasp it. My friends and I, we spend up to about 16 hours a day studying to get into medicine and now grinding through medicine itself. But we understand the importance of a work-life balance just because it's cognitively good for us and it's mentally good for us as well. So we always appreciate the ability to go out and have some fun with friends, to do anything from go-karting to playrooms to treetop challenge, and my own hobby of powerlifting. So you can see that you can always find time outside of education to do something that will kind of relax you a bit and to push you away from the stressful environment that is in your classes. But this is not all. If you are a nature-loving person, as I am, Australia has so much to offer for you. So I have been going around quite a little bit. This is currently my 5th year in Australia. Before my biomed, I did a foundation program for UQ as well. So within all these times, I've been traveling all over Australia, just domestically, and there is so much to offer here. Every state that you go to, high and low, the scenery is different, the opportunities are vast, and don't be afraid to explore something that you haven't done before. So anything, mostly the major cities on the East Coast as well as the south of Australia, I've been to, and trust me, it is, all the views are breathtaking. But aside from this, obviously coming to Australia, there is one key feature that we do not get, especially in Asia, which is the beautiful animals we have in this country. So being able to interact with kangaroos, feed kangaroos, go on hikes beside wombats, as well as to be able to hug koalas and take pictures with them. In fact, the picture you see on your right with the koala is something that was done in UQ itself. So the Faculty of Medicine would bring in animals that is local to Australia within your first couple of weeks at the start of medicine, as well as certain, I think even the normal semester for your undergraduate degrees, and you get exposure to all the animals that we have here. So you can see that there's quite a bit to offer, there's quite a bit to see, no matter whether you like to play, you like to hike, you like animals, you like nature, you like driving, there is just so much to offer here in Australia. But why did I choose to do medicine in Australia and specifically in UQ? The biggest selling factor for me was that a UQ MD program is accepted by the Singapore Medical Council. So as someone who is from Singapore, this was highly important for me because this allowed me an opportunity to always go back home to practice medicine. And I wouldn't have to go through an additional stressful period of time just trying to be able to practice that. But aside from that, UQ is a highly research-focused university, and I managed to experience some of it myself during my undergraduate years. So this is just one of the research that I did. These were a couple of neurons that you can see that are highlighted in different colors. And as science students, we learn a lot of these in classes. We learn the nitty-gritty theory of it, but we never actually get to visualize things. And UQ has many opportunities for you to indulge in various researches at your choosing, and to be able to firsthand see what you learn and see the changes. The biggest highlight for me from my undergraduate year has to be my research. We learn about protein synthesis and how they get recycled, but you never actually get to visualize it. But being able to see a neuron under a microscope that actually in real time synthesize a protein and then translocate it to the membrane and then get recycled, it was the most wonderful thing that I've ever seen before. That's coming from a student who is a little bit nerdy of what I learned. But aside from that, the UQ medical program give us very good early clinical exposures. So that starts actually since first year, and it progressively gets more and more. And by the time, even by next year, I'll be able to get involved in GP clinics, see patients alongside with my supervisor, be able to undergo certain procedures with supervision. And these clinical exposures, in my opinion, are key in kind of designing us to be better doctors for the future, right? Not to throw us to the deep end by the time you graduate and not being able to, not knowing how to interact with patients and not knowing how to do certain procedures. But aside from that, rural health medicine is a big thing here in Australia. And I am really looking forward towards my rural immersion at the moment. But unfortunately, as a first-year student, international student, we do it as an online rural immersion. However, in subsequent years, I look forward to going up to possibly Rockhampton to do a rural placement, which I'm highly excited about because rural medicine is very different from metropolitan health. I won't bore you guys with the details of it. It is quite complex, but personally find it pretty interesting. So next thing is the amount of student support that you get as a UQ student. You get support from the faculty itself, you get support from the union, and you get support from the clubs and society. So just from the faculty itself, at least in St. Lucia, as medical students, we are provided a dedicated space to study. We have our own dedicated kitchen area where we get free milk every week, sometimes food, drinks, and we get afternoon teas as well. And the union is amazing in UQ, let me tell you that. Student union in UQ is something not to be underestimated. The amount of support that they provide during exam period, during the regular semester, it's intense, I would say. So you can actually see campus kitchen. So campus kitchen is something we have on campus that provides students with free food every single day of the week. You will see, if you come on campus, you will see the massive line that we have that lines up for campus kitchen, and the food is pretty decent in my opinion. And during SWOT-VAC, which is our study week, which what we're really currently on, UQ would invite food trucks over so that when you're studying late at night in the uni, you don't have to source out for dinner. And if you see the little Red Bull tower that I have on the side, this is not Red Bull that I bought it. This is a Red Bull all provided by the UQ Union. So they always have these little trucks that come by to the library during the day, during the night. They give you a little food, bit of stationaries, drinks, whatever that you wanted, they will probably have it. So these are the kind of supports that you can expect coming to UQ, and don't be shy about it. You can always approach UQ Union. They're always there to help. These are just some of the physical things that they help you with. You can even get helps like for visa. So, and even if I'm not wrong, you can get help for certain legal things as well. So UQ Union provides many things. And lastly, as a medical student, UQMS. UQMS is holy for us. Currently, we are preparing for our exam, and UQMS has students putting time out of their own studies that will provide us with review sessions. They provide us with things like suturing courses that we get to go in and experience as first-year students that we don't. So student support in UQ, fantastic, fantastic, fantastic. So one last thing is social life. Social life in UQ is not to be missed for. Again, we study hard and we play even harder. So if you join clubs and society, there are many clubs and society out there that will host events for you to do, for you to kind of relax a little bit in your education. And at the same time, we also find time outside of uni and clubs and society just to spend a little bit of time with our friends, hiking around, making food together. So if you can see, if I was you, I would be pretty attracted to UQ at the moment. The amount of opportunities that you get and the amount of things that you can try to do here is immense. So just one last thing, just want to share with you what my life is like in UQ right now. So this is a typical day in my life of what I do as a student. So the mornings, my wake up time is about 6:30 in the morning because lectures are at 8 a.m. typically. And during the mornings, that's where all my tutorials and lectures are kind of pushed towards. But certain days, things like GAF, which is our anatomy facility, which is, again, world-class facility that not a lot of universities have, it do last a little bit longer in the day. Then in my afternoons, I'll probably typically have study sessions with my friends. And sometimes I even take time off to work a little bit. And in my evenings, again, I spend time with my friends. I cook, self-study, and my own me time is highly important for me to just deload for the day and then reset myself for the next day. So thank you very much for listening in. I hope this inspire you to come to UQ, and maybe I'll see you here one day. Thank you very much. Back over to you, Irene.
Thanks so much, Patrick. Every single photo tells a story. So I think you have done such a great job. And yeah, and I think it is so good to showcase not only like life as a medical student, but also you will spend a lot of time at the UQ St. Lucia campus, and there's a lot to offer on campus as well. So thank you to all the speakers that we have. And we have received quite a lot of questions in the chat already. So if you have any questions about our program, the UQ experience or anything, feel free to type it in the chat right now. And then I will address them one by one, but I will start with some of the questions I have already received. So we have received questions about entry requirements, but the one that I want to address first is about internships. So we have the audience asking about, so the question is, internship after MD graduation as an international student. Could every UQ student be offered internship position in the hospital? I mean, they said they have heard the internship offer is limited for international students, and is it the case? So may I direct this question to Professor Carney on the internship questions?
Thank you very much. It's a great question. So putting this into to context, Australia, like many countries around the world, is short of doctors. So yes, you're right, that the first round of internships within our public healthcare systems are offered to applicants who are Australian citizens or permanent residents. What I do know, and this has been the case for every year that I've been here in Australia, is that all international students who wanted an internship here in Australia have been able to secure an appointment. And indeed, last year, at the end of the internship round, both for the federally run and the state-run schemes, the federal government run a scheme with the private hospitals and the state schemes, is that there were vacancies. So there were more internship positions than there were applicants. So whilst yes, I can't provide a sort of a full guarantee for 4 years' time or for 5 years' time, but our experience is and has been for at least the last 8 years, is that everybody who wants to stay in Australia is able to secure an internship. And in addition to that, for every year that I've been in Australia, the Queensland government alone has been recruiting doctors in significant numbers, 200 to 400 doctors per year from overseas to fill vacancies in our hospitals. So the employment opportunities in Australia, I think, are great. May not be able to guarantee the exact place you want to work in, but if you're flexible with where you work, there are plenty of opportunities to follow your passions.
Yeah, thank you, Professor Carney. While I have you here, I have another one about the curriculum. So our applicants are interested in the proportion of online and offline learning during the 4-year curriculum.
So I might let Patrick speak about the experience in year one. I think the faculty have a particular view on this, which is we see the value of in-person learning in particular. So in years 1 and 2, we would typically expect somewhere in the region of sort of 25 to 27 hours face-to-face learning, and that includes classroom-based experiences. The bits that can't be offered online are things like team-based learning, practical sessions in the GAF, and other sessions. Like most universities around the world, lectures continue to feature in the first couple of years, and I think while for as much as people like me with graying hair might like to have people in the lecture room, I think that sort of that argument is increasingly being lost. and I think there is a sort of increasing recognition that many of our students would prefer to engage with lectures, i.e. sessions which are a little less interactive, sort of online. Some of them do that at the time the lecture is given, others do that in their own time when they apparently listen to our lecturers at 1.5 or twice the speed that they originally spoke at. So I think Patrick will be able to give you perhaps a bit more detail around sort of typical in-person online opportunities. But just to be clear that the clinical experiences, team-based learning, case-based learning, our expectation is you're there in person. So whilst there is a bit more flexibility in the first couple of years of our program, certainly as you move into year 2, year 3 for sure, and year 4 as well, the expectation is that you're present, actively engaged, part of the multidisciplinary team on the ward in the GP clinic. But Patrick, what's the sort of the typical pattern for a year 1 student?
Right. So personally for us, in terms of the classes that we have, I pretty much only have 1 online lectures ever. So pretty much all the lectures that are scheduled to have, it's all done on campus itself, except 1, but that's solely because the lecturer has to juggle between St. Lucia campus and Hurston campus. But it really doesn't make too much of a difference for us. But if you are kind of putting in perspective of an online learning and an offline learning. So as a medical student, you have to understand that you must be responsible for your own learning. The faculty provides as many opportunities as possible to give you lectures and tutorials and practicals, but a lot of your learning has to also come from online learning itself that the university itself provide. You cannot be expected for the faculty to teach you every single little bit of it. You have to learn some of the content yourself and come and consolidate your knowledge in class. So we spend every class that we have, no matter lecture, practical, tutorial, there will always be online learning content that's provided for you. Everything has been structured by the course itself for you to do, so you don't have to go and source out textbooks and videos to learn from. The university would have already provided you with resources for that. But I would say I typically spend about an additional 2 to 3 hours on top of lectures to do certain online content, just to kind of consolidate all my knowledge together. But in terms of the amount of lectures that we get, I'll say we only have about 1 online lecture that's via Zoom at the moment, and everything else is right here on St. Lucia campus.
Yep, so very comprehensive answers. So we can now move on to the entry requirements questions. So Kelly, get ready. So we have a couple. So let me just have a look at this one. So the first one will be English language requirements. So we have students who are actually doing bachelor's degree at UQ right now. And I think we can also apply to, like, say, anyone who is doing a bachelor's degree in Australia or in any English-speaking country and plan to study MD with us. So do they need to sit IELTS or other English tests to meet the English requirement? So I believe it is for graduate entry.
Yes, so I believe the requirement is that you need to, if you are currently studying your bachelor degree and you've been studying in Australia at UQ or even in another country with the medium instruction of English for the last few years, that should meet the requirement. You shouldn't have to sit an IELTS, especially if you're already studying at UQ. That is also leads into a little bit about the provisional entry pathway, because the undergraduate degree also allows you to meet those requirements for the Doctor of Medicine. So because you have to meet them for the undergrad there. But yeah, you don't need to do an IELTS if you're currently studying your degree at UQ.
Yeah. And that also applies to like students doing bachelor's degree in Australia or in any recognized English speaking countries.
Exactly.
Yes. Yep. So we have questions. So if we are still on, let me see if we're still on graduate entry, there's one more. So so can the students study other subjects other than like biomedical science. I know a lot of them, like biomed is like a pre-med pathway. A lot of our students are studied biomedical science before coming to the MD program, but is it a must? Can they study other subjects such as biochemistry, nursing, or other science-related topics?
Absolutely. It is actually really wonderful to have physicians with a variety of backgrounds. It helps to bring out the overall nature of what it is to interact with each other, to be coming from a background of nursing or science in another field, or even some sort of an art subject. As long as you can meet the prerequisite requirements, the subject prerequisite requirements, which basically lets us know, yes, you do have that foundational knowledge that you need to be able to study in the MD, then you don't have to do biomedical science. It's just the suggested or the preferred pathway for many applicants. But if you like music and you can meet the prerequisites and you've got that knowledge and the desire to be a doctor, then go for it.
Yeah, well, thanks for that. And thank you for bringing up the prerequisites. So the two subjects are cell biology and systems physiology. So what if a student who don't get, they haven't studied these courses in their degree, or they have already graduated, so they can go back and use up their electives or program electives to do these courses?
Okay, so what you can do is you can apply to study. Our wonderful international admissions team will have a look and see whether there's anything else that maybe you have done that we haven't got listed that will meet the requirement. But if you don't, we do have this wonderful new online course that we can offer you for free. It doesn't take very long to do, a couple of weeks. I think there's some people, if you've really got a lot of knowledge in the area, you could probably do it in less time. But yeah, take a few weeks, online, free. And if you get 65%, it's a 65% pass mark. And if you get that, then you will meet the subject prerequisite requirements.
Yeah, thank you for that. And also, so we will pop in an email address here in the chat later. So if you want to discuss your specific questions or your like specific academic background, you can email us after this webinar, and then we can answer that and provide you the best advice accordingly. So we have a few minutes left, and I will see if we can address maybe one more question. So we do have questions about provisional entry, UK, ANZ, because we don't have a set minimum requirement. So a lot of people are asking whether there's an average mark, cutoff mark, and I think it is the same for like graduate entry, like the MMI cutoff. So whether we will publish that one, or like they need to refer to our minimum entry requirement and then apply accordingly.
Yes, correct. Yes, so we don't have a minimum UCAT ANZ score requirement. And it's very difficult to discuss averages because it changes from year to year. It really depends on the cohort that are applying each year. So yeah, it's a very difficult thing to discuss. But there's a lot of information on the UCAT ANZ website that can help you out. And the aim is just make sure that you've met those minimum requirements. And as I said, we don't have a minimum UCAT ANZ score requirement, but do as well as you can. And yeah, that's unfortunately, I don't have too much more to say about that. Sorry,
Yeah.
but
Yes.
it's only one part of the entry requirements. So just keep that in mind as well.
Yeah. Yeah. Thanks for that. And also, for those who have questions, who still have questions or have your questions not yet answered during this time, feel free to refer to the email address we just pop in the chat. So send us with your questions, specific questions, and we will get on to that hopefully later this week or next week. So before we round up for tonight, I would like to invite the panelists to share one final tip or words of encouragement to our applicants before we close it off. So maybe Patrick, you go first. Or do you
I
need some
would
time to think?
maybe give you a couple of minutes.
Yeah. Okay. Well, Kelly, to you.
I think the best advice I can give you is that we have lots and lots of information on our website. So if you do have any questions at all, please jump onto our website to have a read, and otherwise absolutely email us if you can't find that information you require. But it's a very special time. It's a very nerve-wracking time. So just take care of yourself and try and remain calm. I know it's difficult, but it is a wonderful experience to go through, and just enjoy it.
Yep. And back to you, Patrick.
Right. So I think the biggest thing that I've actually said to other people before, my juniors, is don't be disheartened if you don't get into medicine on the first try. Don't give up too easily as well. Try and explore something else outside of medicine, outside of education, and then come back to it. The medicine isn't running away. It will always be here. No matter how old you are, you can always come back and try it again.
Yeah, good tip, good tip. And last but not least, Professor Carney.
Thank you very much. I think I want to echo what's just been said around taking care of yourself and the importance of how we deal with setbacks and exploring other options. But I'm going to go back to where I started, and that is there are lots of ways in which you can make a difference. And we're enormously grateful that you've joined us today to hear about the University of Queensland. As a psychiatrist, I sadly spend too much of my life working with individuals who are unhappy. I'd like to commend you for putting the time and effort into sort of asking your questions and hearing about the opportunities here at the University of Queensland. I think we offer a wonderful program, but it may not be suitable for everybody. So it's important for you to sort of do the due diligence, to talk to people, to get sort of insights from what's written, from talking to current students, from attending sessions like this, to work out what is a good fit for you. And yes, I hope to see you here at the University of Queensland. Hope that we are a good fit for you. But more important for me is that you're enabled to make an informed choice about where you truly can make a difference. So thank you for joining us.
Yeah, so thank you for all the insights, the tip and advice. So yeah, if there are any questions, feel free to email us to that address. And just a quick reminder that our round 1 deadline for the graduate entry is coming up. So it is on Friday, the 14th of June. So feel free to refer to our application timeline to look at all the specific details. So thank you again for tuning in tonight, and thank you for everyone joining us. So we look forward to welcoming you to the UQ Medical School next year or in the very near future. Thank you.